So, briefly today, going to discuss what autism is. So, now autism spectrum disorder is a combined umbrella, if you will, of several different disorders that are all related to autism, all kind of fit together. This was created with the DSM-5, and so with now the diagnosis of autism, it's actually ASD or autism spectrum disorder, and it encompassed other disorders like Asperger's, which was considered, in the autism family, but slightly different. So now, when you are diagnosed or when an individual is diagnosed with autism, it's diagnosed as ASD and it encompasses all of the others. This umbrella covers lots of different things, and there's a lot of reasons why they did that. But ultimately, if you have a diagnosis of ASD, you gain access to lots of other services and supports that you may or may not need, but most individuals with an autism spectrum disorder need, like language support, speech therapy, occupational support, occupational therapy, sensory input, integration, all of those things, and also behavioral support. Those are three very, very common things for someone with autism. So autism is defined as having an impairment in the area of social communication, social engagement, interaction, as well as restrictive, repetitive behaviors or interest. And this is very narrow restrictions here, very narrowly focused intention on something. So those two things combined, the social and the restricted interest or behavior, that is an impairment which impedes the daily functioning of an individual. It must be present at a young age. So usually signs of autism are present early, 9 to 12 months, but definitely under 3. So usually when we think about autism, if you did not see signs of autism before 3, that would be unusual. Usually some of the signs are there even if they're not always diagnosed that young. So under 3, present somewhere or another, you can see some of these signs. And it is not explained just through an intellectual disability. So obviously an individual with intellectual disability may have issues with language, may have some social skills that they're delayed on, but it may simply be because of the intellectual delay. Versus with autism, an intellectual delay may not be there, may not be present, but because of the autism itself, it is hindering the development of those social skills and that language.